This is Louisiana Delta Community College Paramedic Program. Today we're going to be demonstrating the skill station of pediatric assessment. We're going to verbalize BSI, scene safety, depending on what type of what call we may be on. We're going to look for anything that may clue us into any sort of situation that may not be safe for us. But this one's safe, so we're going to proceed. With a pediatric patient, best to, I'm going to come in kind of soft tone, introduce myself to the patient. Hi, how you doing? I'm a paramedic. Can I talk to you for a minute? Best to sit down by and kind of get on their level. Just going to look at the child and kind of as I approach him. What's he look like? Is he anxious? Is he agitated? Is he calm? Is he diaphoretic? Does he have any? How does he present? Is he bleeding from anywhere? Look at the skin color. How does he respond appropriate to me? Does he answer my questions appropriately? Ask him if he knows where he's at. Is he in school? Is he at home? Does he respond? Does he answer to that appropriately? Does he make good eye contact with me? Is he kind of withdrawn, lethargic, normal, active? I'm just going to kind of explain to him what I'm going to be doing to him. I'm going to check his pulses, make sure they're equal. Down here, pedal pulses, radial pulses, all those are good. I'm going to explain to him what I'd like to get blood pressure from him. And depending on the age that you're dealing with, just kind of explain to them this isn't going to hurt. Just give their leg a little squeeze. And do that. You can attach a pulse ox. Explain to him this won't hurt either. Just gonna kind of attach to his finger there. Sometimes it may be good to demonstrate on yourself just to kind of ease their apprehension. We can go ahead and take a temperature, oral, axillary. Get a lot of vital signs. We'll go ahead and hook it in. Go ahead and start the head to toe secondary assessment. So we'll start up here at the head. Look at the scalp. Is there any depression, bruises, cuts, bleeding, anything like that?
Mm-mm.
Anything behind the ear? Palpate the neck for any tenderness, rigidity, decap BTLS, any deformity. Have the patient sit up just slightly. Palpate the shoulders, the scapula, thoracic area of the spine, lumbar, note any crepitus, deformity, or any pain or tenderness upon palpation. Or inspect each limb for the same. Go ahead and test his strength. Would ask the patient to push out on that outward. Get him to squeeze inward. I would get him to flex. We inspect the abdomen, palpating any tenderness, rigidity, or anything abnormal. I would look for any bruising, ecmosis, or any sort of lesions, cuts, or irritated sites. I'll inspect the lower limbs. And ask the patient to push on my feet like such. Give him to pull down. Push up, out, in. You go ahead and listen to his lungs and heart. Listening over the sternum and the apical, assessing all fields of the lungs, any normal breath sounds, any rails or wheezes, either anterior and posterior.
Then I'll look at his mucous membranes, mucous openings, his nose, his mouth.
Make sure they're warm and moist and pink. No signs of cyanosis around the lips. We'll inspect his pupils for normal reactivity to light. We're going to inspect inside the ear for any discharge or redness or signs of any abnormality.
Or look at his neck for any tracheal deviation or
Jugular venous distension. And pretty much going to cover the pediatric assessment.